as with any substance, the availability of that substance will directly impact how much the substance is consumed and how much consequences of that substance we see in addiction and in public health. Alcohol is no different. So, the more alcohol that is available, the more alcohol is consumed, and the more negative consequences of alcohol we see. And we really, alcohol is everywhere. This image is a remote research base in Antarctica, some of the most inhospitable places in the world, and yet there is still a bar there. Now, bars are important. Actually, on-premise and off-premise locations are both very important because the greater density of these alcohol outlets, regardless of what they are, the more alcohol is consumed. So essentially, the more outlets there are in a community where you can purchase and or use alcohol, the more alcohol is consumed. This is true for off-premise alcohol outlets, on-premise alcohol outlets. This is true for alcohol consumption. This is true for some of the consequences of alcohol use, like drunk driving and alcohol-related findings or alcohol-related injuries. And remarkably, this finding is consistent no matter where the research has been conducted. The finding is consistent in about a dozen different countries. It's consistent between men and women. It's consistent across age groups. It is one of the most consistent findings we have in alcohol research. Now, because we know that the availability of alcohol is directly related to alcohol consumption and the consequences of use, we try to regulate its availability. Now, we regulate it in a lot of different ways. We might limit sales, we might put other restrictions or regulations on it. So let's go through these in order. So limiting sales. So there are some places where there are full prohibitions on alcohol sale and use, or at least in the past there have been. In the United States, we had alcohol prohibition in the 1920s, although that was overturned because it wasn't necessarily completely effective. Right now, there are country-level prohibitions on alcohol use in Muslim-majority countries, particularly in the Middle East. Now, some of those rules are relaxed for foreigners or in other Westerners who are in other non-Muslim individuals in these countries, but they do have these prohibitions in place. There are other state and provincial prohibitions as well, particularly in the states. Some of the states in India have state-level prohibitions on alcohol consumption, even though there's no national prohibition on alcohol use. There are also some partial prohibitions out there where maybe beer and wine are sold, but hard liquor, distilled spirits, high content alcoholic beverages are not allowed to be legally sold. We limit alcohol sales on age, so there are minimum legal purchase age laws in almost every country in the world where you have to be above a certain age in order to actually purchase alcohol. In general, the countries that have these, the ages range from 15 to 21 years old. There aren't many countries, I don't think there are any countries where it's greater than 21 years old. But there could be some, at least I'm not aware of them. And basically, the higher the age is, the less people consume, the less teenagers that consume. Now, the interesting thing about this is that some countries have different age laws depending if it's an on-premise location like a bar or restaurant, and that's the map you see here on this screen, or it's an off-premise location, which you see here on this screen. And there's not a lot of variability, but there is some where they'll actually have different age restrictions based on where the alcohol is purchased and where it'll ultimately be consumed. Typically, we will ban sales to people who are already drunk, which kind of makes sense, right? We don't want people to get more drunk, so we will allow bartenders, and actually we require bartenders and owners of these establishments, owner of off-premise establishments, to not serve intoxicated individuals, and we actually give them the right to refuse service to people who are habitually drunk. Now, these laws that allow the ban of sales to these individuals are very complementary to dram shop liability laws. Now, these liability laws put the bar owner, put the liquor store owner liable for anything that occurs to someone who gets drunk off of their product and then harms someone else, and or harms themselves, depending on how the law is written. So by allowing these people to refuse service, it helps protect them for the liability of what could happen once they exit the bar. We limit when alcohol is sold. So we might have day restrictions, and these are known as blue laws in the United States, which coincided with Christian Sunday services. So these blue laws ban the sale of liquor, sometimes all liquor, sometimes just distilled spirits, on Sundays. We have hour restrictions. So maybe alcohol can be sold every day of the week, but we don't allow alcohol sales, for instance, in the morning hours. So between 12 a.m. or 12 to 12 p.m., or maybe it's 1 a.m. to 12 p.m. or 2 a.m. to 11 a.m. But for some part of the day that we think is most hazardous to people's health, we restrict alcohol sales. Although it hasn't been used much, there is a way using local zoning boards to directly restrict the density of alcohol outlets. This is basically using the laws to put a maximum number of liquor licenses in each community. This would be effective theoretically because alcohol outlet density is so related to alcohol consumption and the consequences of use, but again, it's not something that is widely done. And then finally, there are places that have monopolies on the production, typically more on the sale, but they do have monopoly on the production as well of alcohol. So monopolies on production of sale are quite common. Monopolies on the government or of the government on production is much more rare. These monopolies for the sale of alcohol can occur at the country or the state provincial level, and they're typically restricted to off-premise outlets. You don't have a lot of government-run bars and restaurants out there where you can only get liquor. It'll be the liquor stores and other stores out there that sell this type of beverage. And a lot of these monopolies aren't strict monopolies. They're partial monopolies. So the state will control where liquor and wine is sold, but beer, for instance, can be sold in grocery stores and other corner markets.